All right. And so we talk about application for healthcare analytics, and the next one is why this program at RBS. All right, how is this program unique? And so when I joined Rutgers Business School around 2 years ago, and this program was mainly based on healthcare service management with a heavy focus on management. And as I joined the program, I started to change the focus of program from management to analytics because I think there's a unique demand for profession in this field. And also, especially New Jersey and New York, including the tri-state, there have not been many higher education institutions being able to develop this type of curriculum to address its demands. All right, so the objective for this program is to help professionals who are very interested in getting competitive advantages by applying different types of analytic tools in order to generate data-driven solutions. So ideally, candidates for this program should be data savvy, which means very interested in processing, handling data, and be willing and interested to learning the different skills or tools, including programming tools, and sometimes have experience in healthcare industry or are very interested and devoted to this industry. And then this program is the 36 credit. It is custom. It is customizable, I would say. So basically, what this means is I understand that students in this program were coming from different backgrounds. Some of them might have very heavy analytic skills, but it was in previous different industry. Some of them coming from a clinician standpoint of view have a lot of good understanding, very thorough understanding for industry, but does not have the necessary analytic skill set. So it will be difficult to create a generic program to fit into everyone's needs. That's why I create a program which can be customized based on your backgrounds, based on where you come from. And so you can either you want to strengthen your analytic skill sets, you want to pick up more programming tools, that's fine. And if you're coming from different industry, having prior experience but want to enhance your business knowledge in healthcare, you can do that as well. So the program can waive or transfer up to 6 credits, which means if you have about 5 years working experience and a relevant work experience, and or if you have previously went through MD or PharmD or another graduate level program study and completed study, and we can consider a waive and transfer up to 6 credits. And this will be processed on individual basis. And also the curriculum is a collaborative cross-department and college program building on the business school strengths in healthcare, business analytics, and the general business acumen. So for students in this program, you will have the opportunity to choose courses not just from supply chain department, which is where this program is situated. And you can also choose courses from marketing, accounting, finance department, and from the business school. And also, sometimes you can also choose program, the technical program from the computer science program, as well as the population health department as well. All right, so the team, we have a small but very collaborative teams within the program, and I'm the program director, and Joe Agresta is the program outreach personnel, and he previously was a VP at Johnson & Johnson, and Katrina is a program coordinator, and Neil Resnick is currently teaching in our program, and he was a principal at Deloitte. And Michael Crocker used to help with our program, and he was a VP with Bayer. All right, so that's a small teams. We have a number of other faculty members teaching the program as well, and we work very closely with students in the program. So one of the things I want to talk for the program is we intend to keep the program small, and because the program is very unique, and finding right students fit into the program is also very challenging. So oftentimes our class is smaller considering the size. We have roughly around 20 to 25 students per classroom. and the interaction across students and between students and faculty members are very intense in the classroom setting. All right. So, and you're probably very interested in knowing the curriculum for the program. So here is the ways the program is laid out. And there are 4 different major components. And the first one is the healthcare core, and which takes us 9 credits, where you have the option to choose 3 courses out of the 6 different options. And oftentimes I do provide suggestion recommendations for students in terms of the best practice, but you do have the options to choose any 3 out of the 6. And the next one is the business core, and which is 6 credit out of, or 2 courses out of 4. And then the next one, which is heavyweight on analytics and intelligence core, is basically you can choose 4 courses out of 8 different options. So I did not list all the different options for you to choose from over here. I just highlight some of the sample courses for you to look at. So as you can see from the curriculum, and students is expected to be able to apply statistics, data analytics, and programming in order, as well as the visualization, in order to perform the analytics and once they graduate from the program. And then we also have a recalled industry client project or internship. Depends on if the student is a working profession and taking the program part-time, we can substitute these requirements with one electives in data analytics course. And if a student is pursuing the project full-time and he or she needs to participate in industry client projects or take a summer internship, the substitutes, all right? And so that is part of the requirements. And then on top of that one, and students can pick up 2 courses out of a range of different electives. So here you can think about whether you're coming from the pharma industry, you want to know a little bit more about pharma supply chain, or if you want to do a little bit more technical in machine learning or Python, or if you want to know a little bit more about healthcare industry, including their healthcare law and ethics, or their technology in the healthcare industry, and we provide options for you to customize and based on your background. All right, and so I want to share with you the next one, which essentially is if you are interested in this program, what might be the best way for you to go through? And we do provide a fast track, which is to graduate within 1 year or 3 semesters. And the first one is if you're going to be admitted into the fall 2020, which is the coming fall semester, and the suggestion for students interested in graduating in 1 year is to take at least 12 credits or 4 courses in order to be considered the full-time students. So, this will be one of the options. So if we're looking at the last semester, which is either you want to wrap up in the summer or wrap up in the following fall semester, there are different type of options for you to go through. And one of the points I want to mention is, if you're interested in full-time status, student status, you can take more than 12 credits. That's up to you. And the benefits for doing so is if you take more than 12 credits, based on my understanding from different information sources, you will only pay tuition up to 12 credits, which means if you take 15 or even 18, which I do not suggest, but sometimes students do that, you only pay tuition for 12 credits. Okay, so that is one of the bonus for you to consider that option. All right, and then this is a fast track, and then there's a regular 2-year track where either you're coming from the part-time students working full-time, or you just have some outside business you want to take care of, and you want to spend time and to have a quality time in the program, and we suggest around 2 to 3 courses per semester. So this is one of the most popular options for students to go through the program. And the program can be completed as far as I know, if you want to spend more time and because of personal or business issues, you can spend at maximum 6 years to finish the program starting. However, I do not recommend that route because you want to keep momentum going in order to graduate. All right. So we can have a discussion about curriculum after we finish today's session, but I just want to share with you different options if you're considering this program. Again, as I said, what I'm trying to do is to provide a potential customization for each individual student in the program. Of course, we do have some of the core courses that used to be stay in this program, but on top of those ones, depends on where you come from, excuse me, and we do provide options for you to customize. Student profile. And so this is where students come from. And a majority of students in existing program, either coming from hospital assistant, clinician, MD, physician, nurse practitioners, or executives, or they're coming from healthcare systems. I'm sorry, the healthcare services. What I'm saying, the healthcare service, including the pharma industry, our pharma on that side, I'm sorry, the medical supply and equipment, diagnosis, and accounting and finance and all those different support services. And then the other is referring to coming from different potential industry but have prior exposure experience in healthcare or coming from a pharma. Okay, and so this is the current student breakdown. And I do expect that the mix of students will change over time as we shift from the general management to healthcare analytics. Student profile, and the average years of working experience for students in the program is 3 to 5 years. Average GPA prior to the program, 3.2. And the average age is middle 20 to early 30s. So as you can imagine, in a classroom setting, I'm going to talk about the teaching format as well. And we have a lot of very interesting ongoing discussion because we have a mix of professions coming from all different industries. And students coming from existing students coming from local hospital systems and also the healthcare service industry as well. And the student placement, and we can spend time to talk about this one, but I want to highlight some of students' placement that either go to healthcare specific provider or the healthcare research roles, such as Johnson & Johnson or Robert Johnson, or they went over in the consulting industry, and ECG and COP are two of the consulting companies that have been hiring graduate students, or they went into different settings, and we have students went over Columbia University as a faculty practice manager, and we also have a prior MD students went over Jefferson Universities as assistant professor as well. So as you can see that the placement is quite diversified. It really depends on the student's qualification, where they come from, or how much they learn, or they will be able to put the learning into practice after graduating from the program.